Good afternoon and welcome everyone to our online information and support session. Moving forward after cancer isn't easy. Today we're going to talk about the challenges, and even better, we're going to make some time to move. My name is Kathleen Helgeson and I'm the coordinator of the Patient and Family Resource Center. I'm joined today by Melanie Baruch, counselor at Cancer Care, and Evan Van Dale, exercise physiologist at the Refit Center. They were going to be helping us understand these challenges and the benefits of getting active. We're very pleased to offer this session with the generous funding support of the Cancer Care Manitoba Foundation. I'd also like to take this opportunity to acknowledge that we're meeting from all regions in Manitoba, the traditional land of the Anishinaabe, Cree, Ojibwe, and Dene people, as well as the homeland of the Métis Nation. It's important for us to foster inclusion and reconciliation and encourage others to do the same. Before we continue, there are a few Zoom features that I'd like to explain. You'll notice as an attendee, your microphone and your video are turned off. If you have a question for Evan or Melanie at any time during the presentation, just click on the Q&A icon on your screen and type your question. You can also choose to ask that question anonymously by checking the Send Anonymously box before you click the blue arrow to send. My coworker Ellie is also here off screen and will be helping us manage your questions as they come in. If you have a technical concern, you can also ask Ellie in the Q&A and she will answer your question privately and try to assist you. So our first presenter is Melanie Baruch, and Melanie is a registered counselor with the Canadian Counseling and Psychotherapy Association. She provides counseling to patients and families here at Cancer Care. She also facilitates programs here, and she is the coordinator of the Moving Forward After Cancer Wellness Program. Welcome, Melanie.
Hi, Kathleen. Thank you. Thanks for having me here today and for inviting me to join you on this webinar. I think it's so wonderful that we're taking the time to come together and talk about these important issues. So glad to be here today.
Yeah, we're really glad to have you. And this is a topic that's been suggested by our participants in looking at support for different stages in the cancer journey. So, I mean, a lot of people think that once treatment ends, they're just going to automatically feel better, and that isn't always the case.
No, I think you're right about that. There's such a focus, and absolutely rightly so. There's such a focus on getting through treatment and taking care of oneself as folks are going through treatment, that there is an expectation sometimes that when treatment ends, life will return to normal and everything will feel better right away. And it's a bit of a process for sure. This time of survivorship is a process to heal and recover.
Yeah, and for a lot of people, it seems that the impact, the emotional impact, doesn't even hit them until that point, and that's what we're going to talk a little bit about today. So let's check in with our audience right away, and by launching our first poll. So we're interested to hear from our attendees that are watching what their experience has been like, whether they've noticed that the impact has been more significant after the end of treatment. So I'm just going to launch that first poll. So you should be receiving a poll to your screen. You can select your answer and then submit your poll. To exit the poll, you just click on the exit. So Melanie, can you see that poll on your screen as well?
Yes, I can see it on my screen.
So if you're not seeing the poll on your screen, it may just be that your computer's not allowing it. And you can also use the Q&A to share your comments. So please feel free to use the Q&A if you prefer. So the question just being, have you noticed that the emotional impact of cancer increased following the end of treatment? So we'd like to hear your thoughts on that. So just give it another moment and then we'll share the results with you. Okay, let me do that now. So Melanie, can you see the results there?
Yes, I can. So about 63% of people here today shared that for them, they noticed the emotional impact of cancer increase following the end of treatment. And about 11% said no, and about 26% said it remained the same. It makes sense for sure that the majority of folks are saying that they did notice this. Because usually after treatment, all of a sudden there's a bit more time and, oftentimes a bit more energy. and the thoughts and feelings that maybe there wasn't time for before start to come up and start to play a bigger role in your life. And actually, Kathleen, I've got a few slides that I want to share with folks if it's okay that I go to them, that talk exactly about this. So I'm just going to share them here.
Yeah, just a comment from one of our viewers as you're doing that, Melanie, saying that it's a scary time when the system lets you go.
Yeah, it that comment actually is exactly what I was going to comment. So thank you to the participant who shared that, because one of the things that comes up for folks is that as a time comes, that treatment comes to an end, there can be real fears and a real sense of loss sometimes of not seeing the medical team as much, not having such frequent contact with the doctors and nurses and the folks that took good care of you and helped you when you were going through treatment. And so I really appreciate that comment. One of the things one of the reasons that we're talking about survivorship and why it makes it so important is because of that piece around, managing those expectations. There can be a real desire for folks to return to normal, right? But there's some confusion sometimes about what normal is. Is it the normal that was there pre-cancer diagnosis? Is it a new normal that makes, that fits a bit better now? Is it somewhere in between? What might that be? One of the things that we want to highlight today that's just so important is the fact that distress in the context of cancer is normal, and in the context of survivorship is normal. In fact, the data shows that about 30 to 40% of patients with cancer do struggle with anxiety and depression, and we believe the numbers to actually be higher. This is something that does tend to improve over time, but it really speaks to the impact of this whole experience, right? And just like Kathleen, you were saying, the participants were mentioning, the emotional impact of cancer, oftentimes can start or get a bit bigger and stronger after treatment. One of the, there's a couple different things that might come up for folks that they might notice in themselves once they finish treatment and they're kind of tuning into what they're feeling. And there can be sometimes feelings of, increased feelings of anxiety, right? Of worry, uncertainty, changes in mood, tuning into how they're feeling about their bodies, and perhaps changes in your body in terms of how you look to the world or how you look to yourself. Feelings of grief, right? So grieving the lifestyle that was there before, grieving the health that was there before, grieving perhaps the goals that were there before, and shifting into a new life, a new normal. Certainly a big one is for sure fear of recurrence, right? So coping with, how do I feel? How do I trust my body? How do I know what to look for? How do I protect myself in the future? And, a big one too is fatigue, right? So coping with fatigue. Many cancer treatments, can result in increased fatigue, and this might be something that's very new for folks. And that's something we're going to come back to as well. And so all of these feelings, they all kind of fall under this umbrella of survivorship, and they may come up in pieces, one at a time or many at a time for folks. And so certainly this time of survivorship can be a time of reflecting on what might be a new normal, right? What does life look like now?
Couple of comments, Melanie, just from our viewers. Somebody mentioned, that they had relapsed 4 times, and even after the first time, everyone thought that everything was going to be back to normal right away. And as you said, that was obviously a new normal, like going through the relapsing and the cancer returning. So that wouldn't have been obviously what maybe people around you were expecting that was going to happen. They maybe thought that was it,
And I think that brings up such a good point, because part of survivorship too is managing your own expectations and setting up life for yourself in the way that you want it to be set up, but also working with your loved ones around you, right? With the people around you who also have their own expectations and goals and hopes for you, and balancing the two. Right.
So Melanie, do you notice that, I think it's relevant to talk about just the impact of the pandemic, and in your work, have you noticed that it's been harder for people because of the issues around the pandemic and just the changes in lifestyle that everyone has had to make.
Yeah, Kathleen, absolutely. When we think about the things that fill us up as people, the things that recharge us, the things that make us feel connected to those around us, to activities, to hobbies, just to the world around us, right? Usually, there's some sort of form of connection involved in that, right? There's being able to go out there and to feel safe in our environment and to be connecting with people who we feel safe with and comfortable with. And one of the things that has happened through the pandemic is that we lost that sense of safety, right? That inability to connect with other people in the way we might have in the past. And so these ways of coping that have been so helpful in the past, to varying degrees, have been unavailable for a long time.
Yeah, let's check in with our viewers right now. I'm just going to launch another poll, and this one just asking about your experience over the last year. So again, if you don't see this poll on your screen, feel free to make a comment in the Q&A. So the question is, over the last year, what difficult feelings have you experienced? And we're just curious to know, like, whether or not these things have, intensified due to the pandemic. Just another couple comments while we're waiting for the results to come in, Melanie. Just again, people saying some of the comments about the emotional impact staying the same. Another person saying just scare, the fear again, if it's going to come back, the fear of reoccurrence. And perhaps something that we might be able to touch on is about survivor guilt, when somebody that isn't having as good a prognosis. And that's a complicated, interesting question, I'm sure.
Mm-hmm. Right. And I think that's such a good point, right? In the sense of, how do we manage our own feelings of joy for ourselves and perhaps gratitude that comes with recovering, right? With getting better, with moving away from the cancer care system, but also grieving those who maybe are not in that position,
right?
And feeling that sense of maybe discomfort or guilt, right? Because the two are in such different places. And I really appreciate how all these pieces really kind of work together and how they make us feel.
Yeah, I'm going to end the poll and share the results with you now. And Melanie, can you see the results there?
Yes, they're coming up for me. Thanks.
Yeah, great.
So over the last year, what difficult feelings have you experienced? So about 50% of people are saying they've felt isolated or lonely. 69% feeling that they're lacking energy or fatigue. 50% feeling overwhelmed. 53% feeling more feelings of anxiety or depression, and 50% feeling feelings of frustration or irritation. Yeah, so when we look at these stats, right, I think that's such a reflection of all that is going on, both in the world and personally, right? And the impact of this pandemic in terms of what are our outlets and how do we take care of ourselves, when we don't necessarily have access to the outlets that help us.
So, these are like big, like, really difficult emotional problems to be struggling with. And as you said, even intensified with the lack of support that people may have experienced in this last year. Or, well, I guess we're going on 2 years almost now. So I want to keep saying 1 year, but it's longer than that. And a lot of people, cope with things differently. And, some people feel that they're coping well when maybe they may not be using healthy coping strategies. So how do we know what healthy coping looks like? How do you determine whether someone is really coping well?
I think that's a really good question, right? Because, we hear this word coping and good coping and healthy coping, and sometimes it's hard to put our finger on, well, number one, what is it exactly and what is it for us? Because what might be, good coping for me may not be good coping for you, and vice versa, right? And we're also so different in how we cope and what helps us through hard times. And so actually that's something that I'm going to shift into. Can you still see my slide, Kathleen?
Yes, I can. Yeah.
So looking a little bit, delving into what is a definition of good coping, right? And kind of looking at what does the research say? What does it tell us? What is the actual good definition of what coping is? It comes down to a couple different pieces of well-being. The first being an awareness of your feelings and abilities, right? So becoming more self-aware and considering which areas of your life may benefit from some attention or information or support. So what this means is recognizing the ways in which you are being affected. Are there certain patterns to things that might upset you? Are there certain triggers? But also with this, recognizing what are the strengths, right? What are the range of strengths that you might have that do help you cope, whether it is, personally, whether it is socially. So tuning into what's going on for you. What is upsetting me? What is helping me? What is it that I need? Or for that matter, what is it that I don't need, right? So kind of tuning into ourselves to figure that out. The second piece of good coping is the ability to experience feelings related to the illness without persistent anxiety or depression. Mm-hmm. So what this means is not that there won't be feelings of anxiety or feelings of sadness that come with, feeling what's coming up, right? And the folks out there who joined us today, in the last poll, right? Those were some high percentages about feelings of loneliness and anxiety and depression and worry. So it's not feeling those feelings, but when you do feel those feelings, not having them take over, right? Mm-hmm. So being able to experience them without necessarily feeling like once that happens, we lose all control of them.
Yeah, I just thought of something here because that range of emotion and it made me think of something that I often talked about before in my past work was the frequency, the intensity, and the duration of a feeling. So it's not so much that it's not, like as you said, not about not feeling the feeling, but what we might be concerned about is the intensity, the frequency, and the duration, right? So a lot of feelings come and go, but if they're hanging on for a really long time and, as you said, becoming really persistent, then we might be concerned about that. Or if they're so intense that they're disabling us in some way, then that might be a concern.
Exactly. Yeah. The other piece around, good coping is the communication piece of it, right? So being able to speak of what's going on in an open way. So with somebody who is trustworthy, whether that is a friend or family member, whether it is a counselor or other healthcare professional, but being able to talk about what it is that's going on for you and to do so from a place of openness. And lastly, and I think this is what we're going to spend some time on today, is a degree of personal control, right? So what is in our control? What can we do for ourselves? Where can we access support? Where can we set some boundaries, right? What can we do to focus on caring for ourselves? And actually, when we talk about this, I think something that's really neat is the fact that a decision's been made already, right? Like everybody's here today. We are taking the time to come together today to look at this whole piece around survivorship and physical health. And so I would argue this is actually one thing that folks are doing already in terms of accessing a resource that's available. So, when we're talking about a degree of personal control, there's different ways that we're able to do that, right? And some of those ways are active, some of those ways are passive. Both are good and both have their place, right? So a question that often comes up is one around avoidance, right? And feeling that avoidance, is sometimes labeled as bad. And the reason that I wanted to include this slide is because avoidance of distress, can bring with it temporary relief. And sometimes knowing when we need a bit of a break, when we are not in a place that we can take something that's out there, right? And kind of stepping away from it is actually something that is really important to do. Knowing when to not engage in something that's going to be emotionally hurtful potentially, right? But we do find that active coping strategies in the long term tend to be more effective. Mm-hmm. So, active coping is something that is specific and involves a commitment to looking after yourself holistically. And so it involves accepting that the problem does exist, whatever it might be, and taking action towards working with it. It really is about a shift of focus, right? Focusing about what it is that we can control versus focusing on what it is that we cannot control. And this can be really tricky sometimes, right? Because what is bringing up feelings of sadness or loss, perhaps, is what we cannot control. So it can certainly be a bit of work sometimes to shift that focus. But being mindful, if this is a goal, then being mindful of how do we shift our focus towards that goal.
Mm-hmm.
So there's different ways of coping. And I actually want to preface this by saying that I know we can't see the audience, but everybody out there has coping skills because they've gotten this far in life, right? Everybody out there has really wonderful things that they do for themselves that help them when things get difficult. And we can know this with certainty because everybody is here today. Having said that, I kind of want to bring our attention to two different ways of coping. Because coping can be a bit of a broad term, right? So one way of coping is problem-based coping, right? So this is when there is a very specific problem and the solution is about changing that outcome, right? So when there is a possibility of changing a situation or solving a problem, if you will, this is a problem-based coping. So this might be a matter of, I'm feeling lost because I don't have certain information. And so then the solution might be I have to go and find the right people, find the right information so I can become informed and know what's going on there, right? Or feeling lost in the medical system and navigating your way through that. So certain problems have clear solutions. It still is stressful to go through that, but it means that there's a bit of a clear path in terms of what we need to do for ourselves to cope with that. And this is different from emotion-focused coping, right? Because quite often, the situation cannot be changed or cannot be, solved, so to speak. And so when we're looking at emotions, the work is a bit different, right? Because we have to cope with a feeling that we can change or a situation that cannot be solved. One of the things that we find can be really helpful is shifting the perspective from finding a solution to a problem to treating yourself with kindness and with friendliness and with compassion. And this is about adopting an attitude of optimism and hope, and kind of approaching what is happening, approaching how you are feeling with a sense of compassion versus judgment. Mm-hmm. Something that can be really helpful here as well is connecting with others, recognizing that whatever you're going through right now, you are not alone in it. Sometimes a lot of those feelings that were brought up earlier, Kathleen, what they do is they can make people feel really alone. And I think one of the things that for sure happened through the pandemic is that it's really increased that sense of loneliness. Mm-hmm. And so connecting with others is just so important, right? Whether that is peers, whether it is friends, whether it is professionals, somebody who is going to be compassionate and understanding.
And even the webinars, I was just going to say, even these webinars are an example of just creating connection and finding other people that are going through the similar process as you are and making these connections, even though it's virtual, but it's the next best thing, I guess, that we have right now.
Absolutely, right? And so finding that support and connection can come in a direct form, right? Like actively speaking with someone, but it can also be in other ways, like the webinar, like lots of folks will talk about, podcasts they found really helpful and insightful, support groups online, different content online. So there's different ways to become connected to what is going on that isn't necessarily, meeting with somebody one-on-one.
Do you think it's fair to say to Melanie that in the connecting with others in terms of emotion-focused coping, that you could also probably through those connections find problem-solving solutions as well that you may not have realized, because you kind of get mired in your own problems sometimes and you don't see the solutions, but somebody else, when you connect with them, can actually help you with that too, and recognize that there might be some resources or supports or information that's available that can help you in those ways too.
Absolutely. And I think that's where connection becomes so important, right? Is because we kind of start to see things from somebody else's perspective and we start to feel less alone in our problems and it becomes a shared experience. Mm-hmm. Mm-hmm. And, lastly, the last point on here is that acknowledgement and acceptance of feelings that come up, right? And recognizing that any feeling, right? No feeling is permanent. And so when there is those heavy feelings that are coming up, recognizing that they are there now, but they're not going to be there forever. And approaching them with, without judgment.
Mm-hmm. Yeah, it's challenging to do because in our minds, unpleasant feelings we label as bad feelings, right? And because they feel unpleasant to experience them, and so we want to judge them. We feel, that this is bad. I don't want to feel this way because it's a bad feeling, but really it's an unpleasant feeling, as you said, that will pass if we let it.
Right. We want to judge them. We want to be rid of them, right? Because they don't feel good to us.
Mm-hmm.
But sometimes the feelings that come up, they're really a reflection of perhaps where you are at and what is going on for you. And sometimes these feelings can really serve as an indicator of what is it that you're needing right now.
Mm-hmm.
We emphasize so much connecting with others, and the others is broad, right? Because the others can be content, the others can be, like you were saying, Kathleen, webinars, the others can be a counselor or friends. It really is about sharing what is going on for you with a trusted person and feeling less alone in what you're experiencing, which is different than solving a problem or judging a feeling, right? It's that shared experience with someone else. Looking at some of the other strategies that help, a big one too is stepping back into the things that make you feel good. So often what happens to lots of folks is that, they do a really wonderful job of taking care of their health needs. And part of that though is really focusing on cancer and putting a lot of energy into the cancer experience. And one of the things that can happen through that is there's a sense of forgetting what are the other things that fill me up, what are the other things that I enjoy. And so making a conscious effort to connect to things that are not cancer related, right? To connect back into the activities that make you feel like yourself or that interest you or that engage you is really important too. And part of that, and I know that Evan's gonna get into this, is exercise, right? So becoming active, getting outside, expressing ourselves in a creative way, finding new outlets to express ourselves. And another piece too is, we hear lots of people talk about that through their cancer experience, there's a bit of a perspective change in focusing on what is most important to them. Mm-hmm. Perhaps a reshifting of priorities, a reshifting of values. And so this time can also be an opportunity to kind of take that and go, what do I want in my life? Does it need to look exactly as it did before, or do I want it to look different? And kind of delving into that in whatever way that fits into your life.
Mm-hmm. There was a comment from one of our participants that asked about and maybe some of our other attendees can have some suggestions here and offer some suggestions, because they're wanting to know about ways of trying to get out, I guess get out in the world, and essentially because COVID has limited those opportunities. And I mean, you mentioned about getting out in nature, I guess, and going for walks and things like this, but it is a challenging time when we want to try and encourage people to do things and not be so isolated. And maybe some other attendees might have some ideas on ways of connecting. Things are opening up a little bit more now, but people have to still be careful.
Yeah, I'd like to invite people, if you wouldn't mind commenting on that, right? What are the ways that you found have helped you to get out and get outside and connect with people in a way that's felt safe? Yeah. And I want to add to that, Kathleen, we have to remember too, like where we live in our weather, recognizing that sometimes it's really icy outside and sometimes it's very snowy. And so sometimes we can't access the things that make us feel good, right? Sometimes going for a walk, even if we want to, is not always reasonable.
Yeah, no, it's a really good point, because it's been especially icy lately. So it's really treacherous. Yeah.
I'm wondering if there's any comments that have come in.
Yeah, just some people talking about mall walking, I noticed there. And that Ali will probably give us some other comments as they come in. So we're going to, I mean, as somebody else here just mentioning, I love setting up a walk with my friends. We wear masks. It's such a good therapy for us both. So yeah, some good comments that are coming in. That's wonderful. One of the biggest, I guess, fears that we hear, and one of the things that I think that people experience in post-treatment is the fear of reoccurrence, and for some, the anxiety of that can be really overwhelming and just in some ways disabling, because they're really afraid of doing anything or moving on with their life, or just the choices that they have that are now available to them, fear of acting on them. There's a lot that comes up for people.
Yes, this is one of the biggest concerns that come up for people, right? Because there's an element of trust that's been lost, an element of how do I trust my body and how do I trust myself to know and to pick up on, if something could be wrong again, right? If there is an ache, if there is a pain, is this a, normal ache or pain that in the past may have been ignored, but should I be following up on it? And do I need to worry, or do I ignore it, right? And if I ignore it, is that not good? If I act on it, am I, right, vigilant with what's going on? And so these are some of the thoughts that come up for people, and it can bring up a lot of fear. Absolutely. I'd like to move into that actually. And just drawing from the slide is just, I do want to comment that fear of recurrence does tend to decrease over time, and it can be at its most intense right after treatment. So looking at fear of recurrence, right, and looking at that active coping, it really is so important to focus on what you can control versus what you can't, right? So allowing yourself to feel what comes up, and like we were saying earlier, right, without judging it. Without criticizing it. So if you're feeling worried about something, about a certain, ache or pain, not judging the fact that you're worried about it, but actually, it really speaks to the fact that here you are taking good care of yourself. You're being vigilant. You're paying attention to what's going on for you, because, in the event that something should be wrong, you want to act on that as soon as possible. Addressing the things that you do have control over, right? And looking at what can you do to take care of yourself, and also talking about it, right? Talking about this fear of recurrence, talking about it with your healthcare team, talking about it with a counselor, looking to see what are some of the triggers, right? Is this anxiety getting really big and hard to manage, or have you found strategies that are helpful to you in managing it? This is a really big issue, and it deserves that attention. It deserves that time. Something that we find is really great in helping manage some of this anxiety, right, is trying to decrease the uncertainty, because we know that when there is uncertainty, it's almost like the perfect situation for that anxiety to grow. And so while we can't predict what's going to happen in the future, trying to have some certainty within the uncertainty can be really helpful. So something that we've developed is what's called a calm plan, right? And this is a plan that you develop with yourself, with your medical team, in advance, right? Not in the moment when you're feeling those fears, but in advance, right? Reviewing the plan for what is your post-treatment follow-up care. So knowing the who, the when, and the where, right? Who am I going to reach out to? When, right? Is it at the first sign of something being wrong? Is it after a certain amount of time, right? A week, 2 weeks, longer? And where, right? Is it at cancer care? Is it with a family doctor? So knowing these things, so there's some guidelines for what is it that I'm going to do if I am worried. Identifying concerning symptoms and timeframes for getting these checked out, and knowing who you're going to see about that. So having this information in advance.
Is there a guideline around that in terms of how long, like when we talk about a time frame? Is there a guideline for that, or is that more of a subjective decision when somebody comes up with their plan?
I think that's something that's probably best discussed with people's doctors, right? Because it may be different for each person. It may be different depending on the kind of symptom that comes up. And so I think that would be part of that personalized planning that you're going to do for yourself. We've actually come up with a list of questions that other people have found helpful. And so we're going to share them here on the screen. By no means do people need to ask every single question, but these can be really good in terms of focusing what are some of the things that I need to know to feel comfortable in my plan as I move forward. So these are, what signs or symptoms should I report to you right away? What should I report to my regular follow-up visits? What can I do to lower my risk of the cancer coming back? What is my risk of developing another type of cancer? Who will be overseeing my post-treatment medical care? How often should I return to see you for follow-up exams? What follow-up tests will I need and how often? Are there any late effects I should watch for? And what do I do if I do notice a late effect? Can I get a written summary of my cancer treatment and a survivorship care plan for my records? Do I need to take any special medications or follow a particular diet? What type of physical activity would you recommend for me? And if I have concerns or difficulties with my sexual or reproductive health due to my cancer treatment, who can help me?
Melanie, there's a comment from one of our viewers that their doctor didn't recommend any type of fitness plan. And I'm just wondering, from your experience, are doctors usually forthcoming in offering suggestions, for this type of plan?
I think what would probably come up more often is if there's a restriction.
Okay.
Right. So I think if there's a certain restriction, this kind of question might bring up that conversation if it hasn't already been brought up. And that's a really good question, right? Because there's so much uncertainty sometimes around what exercise should I do and how hard should I push and what do I try or what should I stay away from? And so this is where connecting with somebody who is a bit of a specialist in this field is really helpful, right? Whether that might be connecting with physiotherapy to get this guidance, whether it might be connecting with a program like the one we're going to talk about, the Moving Forward program, to be able to focus on that piece as well. So if you've got questions or there's some uncertainty around it, sometimes it may come from the doctor and sometimes it may come from someone else. Kathleen, were there any other questions about that?
No, there isn't. Yeah, just that comment.
Okay. These comments are great. I really am so glad for the people who are writing these comments and asking questions. It's a really good way to engage the material into what people are thinking right now and what's relevant to them. Part of all this is that if you find that you don't have these answers and you're uncertain about how to go about them, tapping into some of the resources that are available at Cancer Care. These resources are there even when treatment has ended. And so people can access support even after treatment is over. And so whether it is, asking certain medical questions with your medical team, and they may have their own guidelines around whether those questions are directed to them or to a family doctor, but certainly within patient and family support services, connecting with the Patient and Family Resource Center and accessing content that's available there. And Kathleen, that's the resource center that you coordinate, connecting with our dietitians, connecting with counseling services, or other support services as well, or webinars like these, right? There's no endpoint for people to be able to access them. If they're needing support, then they certainly can reach out. So one of the resources that I wanted to share with everybody today is called the Moving Forward After Cancer Treatment Booklet. So some people may be familiar with it, others perhaps not so much. So just wanted to bring some attention to it. So this is the cover page of that follow-up care plan. And this booklet is part of a 3-part series. And it contains information on general wellness and health promotion, reducing future risk and resources and supports available in Manitoba after being treated for any type of cancer. So part one is a personalized follow-up care plan and treatment summary. And this would outline your personal follow-up schedule, including necessary tests and appointments, what symptoms to watch out for, and a summary of the treatments that you've received. So, some teams will use this formal part one. Some teams will provide the same summary, but not using this formal booklet. Part two provides specific information on the cancer that you had, and in regards to its follow-up care plan and any side effects that you might be experiencing and the best course of action for those, as well as any post-treatment programs that may be available to you. And then part three is this one, of course, and parts 2 and 3 are available online. You can access them at movingforwardaftercancer.ca.
Yeah, that's great.
People can read them online, they can print them, review them. Sorry, Kathleen, you were going to say something.
No. Yeah, I was just saying it's a great resource that you can access online there. Yeah.
I want to shift gears here for a moment, and looking a little bit at the relationship between physical activity and mental health, because I think it's probably fair to say that we all know that physical activity is good, and is good for us, but it's hard to know, how much of it or what kind of physical activity and how is it going to impact us. And I just wanted to share a little bit about some of the research that's out there, right? And kind of some of the research has shown that running for 50 minutes a day or walking for 1 hour can reduce the risk of major depression by 26%. Exercise can promote all kinds of changes in the brain, including neural growth, reduce inflammation, and new activity patterns that promote feelings of calmness and well-being. And the evidence also suggests that by really focusing on your body and how it feels as you exercise, you can also help your nervous system become, unstuck, if you will, and move out of the stress response that might be there, right? So looking at the benefits of it as it decreases the risk and helps with anxiety and depression, with self-image, with quality of life and self-esteem. There can be so many benefits to exercise.
Yeah,
and actually,
I know you've got a video. I know you've got a video to show us. And just before you do that, there's just a couple of comments that I just wanted you to maybe respond to, Melanie. One was that a feeling that doctors sometimes are quick to tell patients to get scanned when they have experienced a certain pain, and that causes even more anxiety, feeling like that's a lot to navigate when that happens. And just on the flip side of that, somebody feeling like that they feel like they're being a nuisance when they ask their doctor, to identify new symptoms or something that they've experienced. So it's challenging because you can feel on the one hand like you're being asked to get a scan when maybe that's going to increase your anxiety. On the other hand, if you don't say anything or you're worried that you're going to be a nuisance to say something, so it's a bit of a challenge finding that balance.
It is a bit of a challenge, responding to that first comment that was made. I think it's just so important to say that when there is, something new, when there is a change in a health status, in a certain treatment, right? Beginning treatment, ending treatment, a new scan or a new test, that anxiety is going to go up, right? And that is across the board. Right? People can have wonderful coping skills, but the reality is that this stuff is scary. Mm-hmm. And so it's really fair and common and normal to expect that as these things come up, that anxiety is going to go up. And that's fear, right? We don't know what the answer is going to be, what the results are going to show. Most people will find that once they receive the results of whatever they're going ahead with, right? Or once they finish that treatment, or once they know their team, that anxiety does tend to decrease. So it's very situational. Now, responding to that second person, I so hear that, right? Because people have great relationships with their medical team and they want to be mindful of their time and they don't want to be a nuisance or ask unnecessary questions. But, this is your health, right? You're advocating for your health and you're advocating for yourself. And I think that if you have a concern, it's really important to bring it up. And this is where some of those questions that we were looking at earlier, right, around what are some of the guidelines to maybe help guide what are the types of questions that, what are the types of things I should be looking out for? And from that, what questions do I take to my medical team versus do I wait until my next appointment? And so I really appreciate what that person is saying about not wanting to be a nuisance, but it's your health. And I think if we surveyed probably all the doctors here, we wouldn't have one that would say, don't ask a question, because they want to be able to answer those questions.
Mm-hmm. Thank you, Melanie. Yes, I know you have a great video to show us.
I do, because, as it relates to physical health and mental health, there's a great video that does just such a wonderful job explaining the relationship between the two. And so just want to share that with everyone. So this video is called 23.5 Hours by Dr. Mike Evans. So I'm just going to switch screens here to be able to share that. And Kathy, if you can just let me know when I put it on.
Sure. Yeah, for sure. Yeah, so I'm looking forward to watching this again. It's about 9 minutes, so it's not terribly long, and we look forward to hearing your comments about it. This is a video that Evan also recommended that we watch today. So it's very concise and interesting.
Just sharing my screen here.
Hi, I'm Dr. Mike Evans, and welcome to this visual lecture I'm calling 23.5 Hours. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a good social network. And I mean that in the old sense of the word. Weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all of these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category, but I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Postmenopausal woman who had 4 hours a week of the treatment had a 41% reduction in the risk of hip fracture. It reduced anxiety by 48% in a big meta-analysis. Patients suffering from depression, 30% were relieved with low dose, and that bumped to 47% as we increased the dose. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the #1 treatment of fatigue, and of course the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine, and what is 23.5 hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour, and that if you can do that, you can realize all the benefits I've described in the previous slides. So let's just take a quick walk through some of the literature. So Stephen Blair, he's a professor at the Arnold School of Public Health at the University of South Carolina, and he looked at this in what's called the Aerobic Center Longitudinal Study, which followed over 50,000 men and women over time. And along the left side of this graph is something called attributable fractions, which is a kind of fancy word, but it's the estimate of the number of deaths in a population that would have been avoided if that specific risk factor had been erased. So for example, turning a smoker into a non-smoker, or a couch potato into a daily walker. And along the bottom is the typical risk factors. You can see the hypertension is incredibly important, and so on and so forth. But the one that was that kind of applied the most risk was this sort of mysterious CRF, which is cardiorespiratory fitness, which is really low fitness. So low fitness was the strongest predictor of death. And this is important. Most of the trials we see, to be honest, are funded by pharma or other companies because they've got a drug for hypertension or high cholesterol or diabetes, and we rarely see fitness thrown into the mix. And so it's nice to see a trial that's not so siloed. Blair's work is interesting. He also did another trial looking at obesity. What he found was, sort of two things. One is obesity and no exercise. That's a very bad combination, and that's where we saw many of the negative consequences of obesity from a health point of view. But if the obese person was active, even if they didn't have the weight loss, but were just active and obese, that was much, much better, and that the exercise ameliorated much of the negative consequences of obesity. So if exercise is a medicine, what's a dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week, or more if you're a kid, an hour a day if you're a kid, my flag goes up in the clinic. So my personal take on this is that the literature draws a very broad brush, and so we see big differences when somebody goes from not doing anything to doing something, and after that the return is more granular. So if we took the Nurses Health Study, women who went from zero activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down, so it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise, so it can be broken into 3. Higher intensity, it looks like it's equivalent to less time with lower intensity. But I think obviously the clinical pearl is mostly thinking about your style and habits and your personal cues. So if you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve the 150 minutes a week just with the dog walking. And finally, of course, your commute, getting off stop early, taking the stairs, and so on and so forth. So thinking about that, I'm just going to walk you through some quick slices of the literature. The first one comes from Japan. In the 90s, Japan required all employers to conduct annual health screenings for their employees. And so a large gas company in Japan called Osaka used this to answer a great question. So if people's walk to work was longer, did that reduce their chance of serious health problems? So in this example, high blood pressure. And what they found is under 10-minute walk, no difference. 11 to 20-minute walk, 12% reduction in rates of high blood pressure or hypertension. And over 21-minute walk, a 29% decrease in rates of high blood pressure. So the authors calculated that for every increase of 10 minutes in your walk to work, there was a 12% reduction in the likelihood of getting high blood pressure. The second exhibit is looking at stents. So this is something we commonly do down medicine. So you can see on the left here, the artery's blocked. On the right, a vascular surgeon's gone in and put in a balloon, opened it up, and left a stent to keep it open, which makes great sense. So a German researcher named Rainer Hambrecht looked at this with about 100 cardiac patients. He got half the group to exercise, and by that I mean 20 minutes a day on an exercise bicycle and then once weekly 60-minute aerobics class. And the other half got the high-tech stent and just their sort of normal activity. And after 1 year, 88% of the exercises were event-free compared to 70% of the people that got a stent. So both worked, but I find it sort of incredible that the low tech made a bigger difference. And you have to remember that the stent just fixes one part of the heart. The next way to think about it is the reverse. So what I call sitting disease. We know that being sedentary is bad for your health, but a researcher named Leonard Veerman wanted to quantify this, and he did so down in Australia in a big study they did there. They found, compared with persons who watch no TV, those that spend a lifetime average of 6 hours a day watching TV can expect to live about 5 years left. I mean, that's incredible. But then I think, who watches 6 hours a day of TV? And it turns out the average adult in the USA spends about 5 hours a day watching TV or screens. So I find this fascinating that we never think of the TV as something that's bad for our health, but clearly it's as powerful as many other risk factors for chronic disease. So I'm just going to leave you with, I guess, two quotes. So one is Jerry Garcia, the singer who is the lead singer for the Grateful Dead. And he said, somebody has to do something. It's just incredibly pathetic that has to be us. And I think that's true, that in some ways it has to be us. As Hippocrates said, walking is man's best medicine. And so I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities. But my question to you is, can you limit your sitting and sleeping to just 23.5 hours a day? So something to think about. Thank you very much.
Well, thank you, Melanie. That was wonderful and so inspiring. It's a great video. I want to thank Melanie for the presentation that she's delivered and ask you to stay on so that you're there for some more questions at the end of our presentation. And you've really helped set the stage for our next presenter, Evan Vandale. He's an exercise physiologist at the Refit Center, and as a child he had a love of soccer, which really sparked his interest in exercise science. He graduated from the University of Winnipeg in 2019 and has been at the Refit Center for the last 2 years. So he works to help people achieve their goals, whether it be physical rehabilitation, improving mood, or general wellness. So welcome back to the screen, Evan. Thanks for joining us.
Thank you for having me. I'm really excited to be here and have this opportunity.
I know that this video is something that you had really promoted as well, that we share this video, and it's a great video. And for you, what is the biggest takeaway for you, and why do you think it's so impactful?
So I really like the idea of everybody, if you talk about time, everybody's got a lot going on, regardless of pandemic, pre-pandemic, whatever it is. People are busy, people have things going on, they have families, they have work. If they're going through various treatments, that takes up a lot of time of their day, even week potentially. But just the idea of these 10-minute bouts and getting little bits of walking in. I like the quote where they say not triathlons, it's not super intense. But just increasing your heart rate a little bit, getting up, going for a walk. I think that's kind of the most important part there.
Yeah, so when we watch this video, it seems really doable the way he frames it, right? I mean, just, sit for 23.5 hours or be sedentary for that much. And what is the obstacle? What gets in the way of us committing that half hour in our day to some type of aerobic activity?
For sure. And I think time being kind of the issue, but I think also, people talked about when they're talking to the doctor, they don't want to be a nuance or anything like that, but it's really, you're advocating for yourself, you're putting yourself at the top of your priority list. I know a lot of people, especially, I can't speak to being a parent, but even like having dogs and stuff like that, you put all these people or tasks or work or all these different things at the top of your list above yourself. And it's about really just prioritizing your own health, because at the end of the day, we need to be healthy in order to be around here to help all those other people out. So.
That's so true. Actually, Ellie and I were just talking about that at lunch. It's in those exact words about just prioritizing yourself, right? Which a lot of people in this caring profession and in healthcare put other people first a lot of times, even in their personal life. So it can be challenging.
And it's even when people have quite a exhausting job and things like that, they come home the end of the night, maybe you don't want to do the exercise, but it's, so working away, trying to figure out that 23.5 hours and giving that bit of time for yourself.
Yeah. Well, let's check in our last poll that we're going to give to our audience. I'd just like to get a sense from them how they feel about exercise. So I'm just going to launch the last poll. And again, if you don't see this on your screen, you can share a comment in the Q&A or the chat. So the question being is, what is your present comfort level with exercise? So for some of us, it might be something we've done our whole lives and we enjoy doing it. Other people really resist doing it, don't like it, would like to do it, don't know where to start. So just feel free to comment there on how you feel about exercise. And somebody's made a comment, I see that about chair yoga and Tai Chi and Qigong. So there's things that can be done that are, like, and I guess maybe you could talk a bit about that too, in terms of the benefits of doing some of those things too.
Definitely, yeah.
We'll just give a moment more and then I'll share the results once they all come in. There was a comment or a question, maybe just while we're waiting, Evan, you could answer. Just somebody asked about walking in cold air and the challenge of that for someone that has lung cancer. And I'm not sure if you get that question at all, like in terms of what one can do if they want to go outside and just faced with the cold air. But we can come back to that. I'm just going to end the poll right now and share the results. We have about 83% of our attendees have commented. So there you go. Can you see that, Evan?
Right. Yep.
Yeah.
So it looks like we got a pretty active group here, looking at 58% that are enjoying it and it's a part of their life, and that's really, really good. I'm comfortable increasing my level of exercise, 42% good. I don't like it and resist doing it, 3%. I exercised in the past, but I'm now worried about pain. We'll touch on that. Pain's definitely a big barrier that we often see there. And I would like to exercise, but don't know where to begin. So you can probably even kind of combine the pain and not knowing where to begin. People are, if we're looking just at like kind of our stages of change, people are wanting to get going, but maybe don't know how to start.
Yeah.
So we got about 30% of people falling into kind of that, I guess.
Yeah.
And yeah, having almost 60% that are already active and enjoying it, that's fantastic.
Yeah, that's great. Yeah, I'm just gonna stop sharing for a moment. Evan, something that we've talked about before in past webinars too is just the impact of fatigue, cancer fatigue, and
For sure.
and could you comment on that in terms of like how much does that play into people's motivation to get going, to increase their activity?
And I've read some studies done that even like during treatment, after treatment, even pre-diagnosis in some cases, fatigue is the #1 kind of reported symptom or thing that lingers on. And then we get into this conversation about the fatigue cycle where we're fatigued, we don't have energy, we're really tired. And then even getting further into that, but the cancer fatigue is a different kind of fatigue. I should mention that first. It's not like just feeling tired. It's kind of this draining, just a lot more intense of a fatigue sensation. And so when we're fatigued, tend to be the response is that we go into this thing where we don't do anything. We're fatigued, we get into that couch potato kind of phase, we're resting, and we just don't have the energy, which then in turn kind of decreases our energy, which gets us into this cycle, and then we're more fatigued, so we don't do anything, then our energy is lower, we get more fatigue. So breaking that cycle is really the most important thing. And this is where support networks come into play. I think a couple of comments kind of popped up about motivation. So having different people around you, whether it's a spouse, kids, family members, friends, coworkers, whoever's close to you, and having conversations about if they're able to get active with you, having a walking buddy. They talk about dog in the video, but having friends or something that want to go do things with you, having an accountability partner, things like that are really great ways to kind of break that cycle. And then once you break it, again, going back to the 10-minute bouts, like a 10-minute walk, if you can get 2 of those in a day, say get 20 minutes. If you do that every day, you're hitting 140 minutes of activity with that kind of end goal of 150 minutes. So getting into these, breaking it down, try not to overwhelm yourself. I know a lot of people, maybe they'll just jump into it and try, 30, 60 minutes, and then their fatigue just skyrockets the next day, and then it's kind of a downward spiral. So really trying to start slow, ease into it, and just being consistent and trying to build some habits so that you're getting into this flow of making activity part of your everyday
life. I like this comment someone made about reframing your thoughts. So saying to yourself, I get to exercise, as opposed to I have to exercise, well, that it's a privilege to be able to do this.
We'll often talk about accentuating the positive. And yeah, that's really like some people really don't have that ability. And so taking advantage of moving your body, treating it as, people talk about dance and stuff, like self-expression, and just, being kind of thankful for the ability to do that. So.
Right. Can you tell us a little bit about what deconditioning is? You mentioned this when we were doing our planning for this webinar, and I hadn't heard that term before.
Yeah. Yeah, so deconditioning, again, kind of related to the fatigue thing. So when and if you're going through active treatment or through the pandemic, we were, this kind of lockdown feeling, people, and even can still, you order your groceries, it comes to the door, you're not leaving the house as much. So we get to this state where just our muscles are kind of atrophied. We literally don't have the muscle mass that we used to. And then our cardiovascular system, so that the ability of the heart and lungs to kind of work well, to get us blood and oxygen to be able to exercise, we slowly start to, and it's not going to completely deteriorate, but we slowly start to get in this deconditioning where our levels of being able to be active are just a lot lower. So we might even struggle with that 10 minutes. And there's then we get into other conversations. It's very individualized and specific. But can you get up and do some standing movement for, say, 5 minutes and then take a bit of a rest and then do it again? So now your 10 minutes is maybe 15 or so with a little bit of a break in between. But just trying to break that deconditioning the same way we're trying to break that fatigue cycle.
Right. Evan, why is it important to consult with the doctor? Is it your doctor that you'd want to talk to about starting an exercise program?
Yeah, and I think Melanie kind of touched on it before. So really the doctor is going to mention restrictions to you, which is good. And then you can take that information and apply it. But yeah, like if you're going to be working with somebody or doing exercise on your own, it's really important to get kind of clearance and make sure it's not going to be harmful to you. And we do, for exercise across cancer, whether it's pre-diagnosis, during treatment, post-treatment, we see benefit from exercise. But yeah, we really want to make sure that, some medications and things like that have side effects, maybe dizziness or something like that. So we want to be aware of that when we're doing exercise so that we have appropriate balance. If it's related to balance, we have appropriate structures in place to keep that safe. That's really the big thing, is safety. So.
Yeah, good. Okay, thank you. Yeah, and falling is something that we're very, aware of, just the risks of falling and how important it is to have that,
yes.
Like you say, that safety, so that you're doing things safely. You are going to be showing us some exercises that we can do at home, and we're going to try those out today.
Yeah.
And we're going to start to move. We've all been sedentary for so long, it feels like a real effort to get out of the chair. And there are some other questions that have come in, but I'll leave those until we do a bit of exercise here so that we get a sense of what we can do.
Okay, so I'm just going to bring my computer up here so I can kind of get a better view of the room here so people can see what I'm going to be doing.
And Melanie and I, we will join in over here. So, and hopefully that you do so at home too. But again, with that.
So I think we're able to see me there. I can probably bring it down slightly.
Yeah.
Okay, so really, and this is so at home, the only thing I have is a chair. So hoping most people have access to a chair, a bed, something like that they can have a seat. So from your chair, you're going to come forward in the chair. Just so kind of your bum's comfortably on the chair. If you have handles, you can utilize those as well. Our first exercise is called a sit to stand. So we're literally going to go from sitting, try to swing your weight a little bit forward here, and then stand on up. You can cross your arms if you like. It just kind of keeps them out of the way. And then sit back down, nice and slow. So try to control yourself down. We're going to do 10 of those. So you can do them either with me, if you want to follow Melanie, and by getting a good, so this is working all the muscles of the legs, so the hamstrings, the quadriceps, the glutes, so kind of all the major muscles of the legs there. Making sure this is something people can do at home. And then I'll just demo a progression. So then if you want to try to make it a little bit tougher, so you can work on being nice and slow coming down and just touching your bum to the chair and then standing up. So that'd be kind of our next level of that. So all the exercises we're going to go through, we'll do them once, and then we'll do them a second time through as well, which will be called 2 sets, as we would say. And I believe we got one more here. So stand all the way up again, and then we're going to stay standing this time. Okay. So let's take our chair now. I'm just going to turn it so I have a support with the headrest here. So hopefully you can see that there. Now you can't see my toes. That's okay. You're gonna have your feet about hip width apart. So just kind of a nice balanced stance here. Hold on to the chair here. You're gonna come up onto your toes, just see me kind of elevate, and then come back down. Up onto the toes, nice and slow, back down. So you're gonna feel kind of those calf muscles just above the heel, the back of the leg, back of the lower leg, I should say. Good, so some things, if you want to challenge yourself, if you're comfortable, you're able to take that hand off, and then you get a little bit more balance work. But yeah, having that support there of the chair is good to get started. All right, let's do one more here, all the way up and back down. We're going to keep the chair here. We're going to work on some balance and some hip range of motion. So I'm going to stand onto one leg here, holding onto my chair for my support. I'm going to bring my leg out to the side, nice and slow back in. Bring the leg out, then come back. So we're going to do 8 on each side of this one here. So come out. Again, if you want to challenge yourself, you can take your hand off the chair. That's going to make it a little bit more difficult here. So holding onto the chair for support. Try to pause and then come back nice and slow. Last one. Good. I'm going to take my chair. I'm going to swing it to the other side here so I can do the other leg. All right. Same idea. Out to the side, nice and slow, back down. Good. Trying to keep most of the body pretty steady and really just working the range of the hip here. Trying to come up as high as you can and then back down. So these are the ones that get quite stiff and sore. If we think of the joint of the hip, anatomically, I guess, how your body's set up, it's the same as the shoulder. So you got this ball and socket, so it should be able to move quite a bit. But typically, if we're sitting most of the day, we're not bringing our leg out here. So working on getting these big muscles of the hip and glutes work. Good.
I'm sure that's more than 10.
We're going to take a break here, so catch your breath a little bit. If you have some water, you can grab a sip of that.
That felt like more than 10, Evan.
Potentially, yes, I was talking, sorry.
It's okay.
So we'll come to a wall here, if you have a wall handy. And we're going to do a wall push-up. So you're going to start with your feet slightly back. You're going to bend your arms, bringing your nose toward the wall. And then just like that. Let's do 2 more there. Good. All right. We're gonna do one more with the chair here. I'm gonna have this. So hopefully you can see. So we're gonna have, again, start with both hands on the back of the chair here. So to start, so we're gonna have 2 levels. Level 1 is gonna be bringing your leg back and then bring your leg to standing. So reaching your leg far back behind you and then pull it in. So you can alternate each time here. So the next, what would be level 2 here would be adding an arm. So you still got one arm supporting you on the chair and then alternating arm and leg. So we call it a standing bird dog. Working on your core strength, trying to get a nice stretch through the hip. Get some range of motion through the shoulder here.
Ellie's laughing at me.
Let's do one more each side there, wherever you're at. Good. Then we can come back and we're gonna take a bit of a rest. We'll do a couple stretches and then we'll do each of those one more time. So from this position here, I'm going to bring my arms up beside me. And then I'm going to think about squeezing my shoulder blades together and opening up the chest, getting a nice stretch through here. You could also just have your arms straight out and squeeze those shoulder blades together as well. Whichever is more comfortable for you, doesn't matter. Try to keep your shoulders down away from your ears. So you're just squeezing them together there. Get a good stretch, good. So opposite now, you're gonna reach out in front of you. Think about pushing through the back, reaching those arms forward, stretching through those shoulders, kind of the opposite way. And again, try not to have the shoulders up here. Relax them down away from the ears. And so, yeah, stretching, we were talking about the Tai Chi and yoga and stuff like that. Stretching is a really, really, really beneficial activity. So if you're able to make it part of your either morning or nightly routine, it also helps you wind down and get ready for bed. So if you struggle with sleep, if there's some kind of, you have insomnia or something, that can help you wind down, relax the mind, go through some kind of just self-mindfulness, do a bit of stretching, try to loosen up, especially through the neck. So that's what we're gonna do next. So if you take your head, drop ear to shoulder, and try to take your other arm here, press this away. You can see that there. So making this section of the neck nice and long. If anything's painful with stretching, you're doing a bit too much, so maybe come out of it if it hurts. You just want to stretch. You want to hold them about 15 to 20 seconds. So come back up here, and then we'll go to the other side. And then you can press that arm away if you like. I think there's some other comments. There is a lot of great content now. So kind of that came out with the pandemic. There's lots of great exercise videos and stuff like that online from so many sources, but with either like a tubing band, very little equipment, or no equipment at all. So making sure it's safe for you.
Evan, before we do the sit to stand again, someone just had a question. Is there a modification if you have knee issues for the sit to stand? If that is that?
Modification for the sit to stand, is that what?
Yeah.
Yeah,
Mhm.
for sure. So depending on what it is, we'll get people on a wall. So I'm just gonna move my chair out of the way here. And we'll typically get them to have their feet anywhere 8 inches to 12 inches away from the wall, I'll say, and then work on sliding down just a little bit and come back up.
Okay.
So we want to work on getting the strength in the legs and the range of motion through the knees,
Okay.
just little bits at a time. And then
So that would be a good modification if someone's
for
knees
sure.
bothered
And you got
them.
good support. You could also have the chair if you're really nervous about it. You could still have the chair there.
Yeah.
Same type of thing. Then you're supported by the wall. So
Good.
yeah.
Thank you.
Making use of the house structure to support.
Mhm.
So yeah, so we can go through those one more time there.
Sure.
Yeah, and that'd be kind of a nice little routine to get going. So if people are looking for things to get started, it doesn't have to be much, but
Yeah.
any good thing is going to help. So we'll do those sit to stands again. So again, you can do that kind of wall sit or sliding on the wall there if you do have knee or hip issues and this is bugging you. No problem with that. I'm going to try to do a better job of counting this one. I told you that counting and keeping track is the hardest part of my job. There's so many other things running through your mind. And really trying to control that sit down nice and slowly. Good. Perfect.
I feel like doing this even gets you breathing harder.
It does, for sure.
Mhm.
We can get into conversation about ergonomics and stuff like that, but even people that have desk jobs, if you're able to stand up and just take 2 minutes of standing and stretching every hour, 2 minutes for yourself, you see a huge increase in productivity and in kind of just, health of the spine and things like that. We'll come over here. You can put your chair on either side for those calf raises where we're coming up onto our toes. So again, nice balanced stance, we'll hip width apart, up onto the toes, control nice and slow down. if you get kind of that like snap, crackle, pop in your ankle, as long as there's no pain associated, that's fine.
How do you know when you've overdone it or you're overdoing it? Somebody's asked a question other than obvious pain. Is there an indicator of when we should stop?
So starting slow is going to be the answer. We typically call it DOMS, D-O-M-S, delayed onset muscle soreness. So delay, unfortunately, means you're not really going to know until the next day. But yeah, starting slow. So again, with those 10-minute walks or something like that, and keeping it pretty easy, and then evaluating how you feel and then building up.
Okay.
So when we talk about that 150 minutes, that's kind of your goal. We don't have to do that right now. That might be a big jump. Right?
What is metatarsal? If you have problems in the metatarsal area, someone's asked a question about a modification for going up on the toes.
You might just work on some range of motion sitting in the chair, so coming onto the toes, so there's less weight. Or you could have, like, if you have books or something like that, put them on your knees,
Okay,
and then instead of moving your whole body weight,
just a little bit of weight.
less
Okay.
weight.
Yeah, and another,
Those
just
range of motion.
yeah, another a bilateral meniscectomies. I don't. Do you know what that is?
I'll have to see if I can read.
Bilateral meniscectomies and some RA. Not sure.
So I can speak a bit to the rheumatoid arthritis. I'll have to freshen up on meniscectomies. But so yeah, with the RA there, with the rheumatoid arthritis, we do see kind of similar with the that muscle soreness and kind of flare-ups. So we really got to go day by day, and I know a lot of times it's affected by weather and different kind of environmental pieces as well. So we have some people in different programs that are kind of with some rheumatoid arthritis, and we want to avoid the flare-ups, obviously. But there is some kind of unpredictability, which is, I mean, people talk about it too. The problem with fatigue is that we don't know how to treat it, right? Same thing with the flare-ups of rheumatoid arthritis. We unfortunately don't know how to treat it. So we have to kind of mitigate it as much as we can. And that's kind of the best answer I have.
Thank you. So we're out to the side.
But, so this is called leg abduction. I guess we can just talk about exercises. So the leg's coming away from you, and then it's adding back in when we come back to our center. So this is where counting becomes difficult because now I'm thinking about all the other.
I think that was 6.
There you go. Good. Okay, let's switch sides there. Can do that second leg. People might even notice some soreness with this just tomorrow. And that's okay. Soreness, as long as it's only lasting a couple of days, is fine. That's how we get that adaptation in our muscles and we get stronger. So when you're doing exercise, that's actually when we're kind of breaking the muscle down, and then we're sleeping and resting. That's when we recover and rebuild. That's why sleep's such an important part as well. One last one here up to the side. Good. Find your wall again. We're going to do one more of those wall push-ups. I guess the next level I can quickly show as well is if you have that chair and if you have good armrests on it, you can work toward bringing that push-up lower. But for now, start at the wall. Come this way. Think about bringing your nose just toward that wall and pushing yourself gently away. Two more there. You guys are almost there. One more. Good. We got that one more core exercise there, that standing bird dog. And we'll wrap up with the exercise piece.
Oh, yeah.
So again, level 1 there, you got both hands on here, bringing your leg back. So while you're doing this, you can think about squeezing those glutes nice and tight at the back. So getting some extension, which is working kind of through the whole posterior chain. So working through your back, shoulders, through the glutes and the legs. And that's again why stretching is so important. Everything's attached. So sometimes if you go to a physiotherapist or something, or if you come see someone like myself, if you're complaining about back pain, I might be addressing your calf and your hamstrings, because if those are really tight, they're going to be pulling on your bum and pulling on your back. Do one more each side there, almost there. Nice and controlled. I'm going to come back to my spot here, bring my computer down.
Thank you, Evan. It's just getting up and getting going seems to be the hardest part of that. And then once you get going, you get a bit more energized. There was a question I just noticed there about alternating upper body and lower body in terms of workouts. Any thoughts on that?
Yeah, we can get into kind of conversation. So if you're one of those people that's already quite active, if you're looking to have 3 days of exercise, we'll typically talk about doing 1 day that's focused on lower body, 1 on upper body, and then that 3rd day being a full body routine.
Okay. Mm-hmm.
That gives us that kind of appropriate rest period
Mm-hmm.
where we can recover in between. So if I do just upper body Tuesday, lower body Thursday, full body sometime on the
Yeah.
weekend, then
So
I
how
have
about,
that.
did anybody notice how many minutes that was that we just did there of exercise? Because it feels like we did a lot. Because and yet it didn't seem like a huge amount of time, but it felt like it had some impact. I don't know if that was like, I think that roughly was maybe 10 minutes or so, or maybe just slightly over that, eh, Melanie? Yeah.
Not the exact minutes, but got the blood flowing. So that was very, very nice to do.
Felt
Yeah.
like 15 apparently.
Yeah. Yeah, no, thank you so much. If anybody has any final questions, we'd like to be able to answer everybody's questions. There was some more specific questions, about certain health issues relating to, muscles and that, but we may not be able to get a chance to get into those details. Somebody did, I just noticing there asking about using weights, and I guess that would also be very individual in terms of somebody's strength and comfort
Definitely.
level
And
with
it's
that.
also through the pandemic, accessibility has been a big one. So not everybody has equipment at home. But yeah, if you have stuff at home, then there's obviously the more equipment you have, the more variety we can do. So it's just an opportunity to kind of show some things with minimal equipment that you're able to get your body moving. And yeah, hopefully that 10 minutes felt pretty good. And you can kind of see the benefit from just that 10 minutes. So if you did that, once in the morning, once sometime in the evening before bed, you're doing really well.
Yeah. Again, there was a couple other questions and perhaps, again, we may not be able to get to some of those questions about, about some of the health concerns people have around different parts of their body. But Melanie, did you just want to share a little bit about the Moving Forward After Cancer Wellness Program?
Yes, just seeing some of the comments that have come up and wanting to inform anyone who may not be aware of the program. We have a program called the Moving Forward After Cancer Wellness Program that actually Evan is involved in facilitating. And this program is for folks who've completed their treatment in the past 2 years. This is a 10-week program that meets twice a week. That has a pretty heavy exercise component in addition to different educational pieces that relate to emotional health, nutrition, physical health, and so on. But the really great thing about it is I think somebody in the comments was talking about just some of the benefits of connecting with groups or a structured program that is with people who are supportive and understanding. So just want to encourage folks, if you're interested, to sign up for the program. There is a little bit of a wait list right now, but if you're interested, by all means, call the department. And I think if I can just ask Ali if she can put the number up in the chat for the main department number, and you can call and get registered for the program.
Okay, great. Thank you. I know there's wait lists for a lot of our programs since people have been waiting over these months, but yeah, Evan, you showed us some great things that can be done at home. And as you said, there's lots of resources too online for people to look into. If anybody's interested in other resources, for sure, you can contact me and I can look into it further and forward you some links as well. Just a couple other quick questions. Does cold air hurt your lungs? Do you have, is there an answer for that question?
So there's typically 4 functions of the lungs. So they moisten the air, they warm the air, they humidify, and they cleanse it. So thinking about that warming factor, yeah, if the air is colder, it's not necessarily hurting your lungs, but it is taking more effort upon your respiratory system to get that air, functioning throughout the lungs.
Mm-hmm. Great.
Keeping it not too physiologically.
Yeah, no, that's great.
Yeah.
Well, and I know, I mean, even with a mask on, it warms the air, even with that. So, yeah, I'm sorry if we didn't get to all of the questions today. We've gone to our limit of time right now. So, I just want to thank you both for participating, and for our audience for all their great input and questions. And it's been a great interactive experience today. So it's fun to actually do something. I feel like we did something together. So that was nice. Yeah, that was nice. I thank you both. We look forward to your feedback. So please take the time if you have to complete the survey that we'll send out. So we'd like to get your feedback about this presentation and any suggestions for future presentations. Just to let everyone know, the next presentation will be in January, and that's going to be Ann Katz, who's going to be speaking about body changes with cancer, and then the impact on our self-image and on our relationships and intimacy. So that'll be an interesting discussion as well. Okay, well, thank you very much. Actually, there was a question, is the Moving Forward program geared towards a certain age or activity level? Maybe Melanie, you can mention.
It's for anyone and everyone. So there's no certain age or activity level. People come with, wherever they're at, and they'll work with Evan and the rest of the group to work on their own needs wherever they're starting from.
Okay, great. I quickly want to mention, just because we're talking about this program being in Winnipeg, this is some new information about a research project or program out of the University of Calgary geared towards people in rural areas. So if you're interested in this, call me at the Resource Center. They're looking to recruit about 1,500 people. It is an online program for exercise and for cancer patients, but geared towards people in rural areas. So if you're living outside of Winnipeg and you looking for something that might motivate you to get active, this could be it. So give me a call and let me know. Okay. Thank you very much again, and thank you for everyone for joining us. If you have any other questions, feel free to contact us at the Resource Center here, and we'll be able to help you.
Thank you.
Take care. Yeah, happy holidays, everybody. Thanks for joining us.